Hello, K-Fresh McGillicuddy here. Today we're going to be learning how to fill a syringe for the stomach pump, the food pump, with Senna, which is a stool softener. When you've had thoracic surgery and everything's all messed up, you don't want to be pushing and straining, trying to blast a fudge packet. You want everything to go smooth, so we have to use this. So what we do is always, we wash our hands with hot water and antibacterial soap. And I did that last time. Yeah, that's a real life story. Just do it, okay? People's lives are at stake here. Okay. Sling your hands off. Get a syringe, and we're only doing 5 milliliters. So since the things on this are hard to see, I marked the line, that small line there at the very end, that's 5 milliliters. Second line is 10, this one is 30. So we're just doing 5. So probably helps if you take the top off this first. And hold this upside down. Put it where you can see it, because you don't want to have parallax cause you to have a false, you think it's full but it's not, or vice versa. Hold it up to your eye level so you can see when it gets right to that line. Then pour this in until it gets to that line, like that. You can add a little bit of water. You don't have to dilute this like you do the Pro Source, but you can add a little water just to give it a little more volume and help it flow better. Just a little. Doesn't matter. Then, like we did with the other things, put the plunger in just enough to seal the bottom. Flip it. And then get the air out of there. Yeah, gliding. And push it to the top. This syringe is the tough one. Push it to the top like that, just to the point where it's to the tip. And then a little bit to the edge. Okay, that's close enough. And then tap it up. Cap it off. Pretty simple. It's one of the simplest ones. Cap this back and then ready to go. Again, these healthcare tips are only applicable if you have a patient named Robbie in Eastern Tennessee. It will be fatal to all other patients. Thanks for watching and have a great day.